Welcome, everybody, to another episode of Dr. Dallas. I am here with Anjelica.
What up, what up?
And today's going to be a little bit different. We're going to have what's called a bite-sized surgical nugget.
Ooh.
Right? So little, pieces of information that we picked up that we think our patients would really benefit from, kind of teach them about one specific topic. I think that'll be kind of nice, right? So it's not going to be too long. Today, we're going to be talking about something really, kind of close to what we do every day in the operating room. But Anjelica, I was out of town.
Yeah, you were. Over the weekend, you were at a breast conference.
Yeah, breast conference, exactly. Yeah. And I missed you guys.
Oh, we missed you too.
Yeah, thank you. So
it was see you on Friday.
Yeah, and so I was gone for 3 days. It was Atlanta Breast Symposium, more specifically. But the really cool thing was that it was sort of the latest and greatest on breast implants, breast surgeries, what to expect out there, and some of the new things that maybe people have been hearing about.
Right.
And so there's been a little bit of this scare around about implants and the possibility of implants causing cancer. Have you heard about that?
Yeah, I heard about the textured implants having a cause too.
Yeah, possibility. So I don't know if any of you guys have heard of that, or maybe when you're thinking about, hey, I want a breast implant, you start doing some research and you come across this, website. But there is a type of, not breast cancer, because that's a little bit different, but an actual type of lymphoma that has been associated with a textured implant.
Okay.
And so when you guys come across something on the internet and you read something that says BIALCL, you know what that means?
From what I can read, it says breast implant associated anaplastic large cell lymphoma.
Exactly. So it is when you hear someone say like BIA, ALCL, or you see those initials, basically it's, representing breast implant associated anaplastic large cell lymphoma. Wow. So it's not a cancer that we think about when we think about breast cancer that happens in the glandular tissue. This is something that happens more in the lymph nodes. That's why it's called lymphoma. Okay. And so I don't want people to get worried about, hey, I have implants. Is this going to happen to me?
Right.
I think we need to make that distinction that it's actually textured implants, right?
Yeah.
Do you know what I mean by textured?
Yes.
So it's the implants that have that sort of like gritty surface to it.
It's like a different material. It's not like a smooth, it's a silicone implant.
Yes. The insides, the guts of the implant is exactly the same, but the exterior is textured.
Yes.
And so it's a sort of like gritty texture as opposed to, like you said, smooth implants.
Right.
And so it's this textured implant that has been perhaps associated with this type of lymphoma. So lymphoma. So only textured implants. And probably more specifically, there's 3 main implant manufacturers. You have Allergan, Mentor, and Sientra. Right. We typically use one of the larger ones. Allergan's actually one of the larger ones. Mentor's probably the second. But Allergan's textured implant is the one that they were seeing some of these BIA, ALCL lymphomas. But we're talking probably about 1% in the world. So we're looking at maybe a couple hundred. But these are over, hundreds of thousands of cases.
Right. So
we're not quite sure why it happens. They think that the texture, that gritty surface, is somehow causing some sort of inflammatory reaction, and that constant inflammatory reaction somehow stimulates our immune system to then, rapidly divide and then eventually causes lymphoma. Shaped implants. Remember shaped implants? They're more teardropped.
Yes.
So I'm not sure if people out there who have talked to surgeons about breast augmentations, the shaped implants, they were all textured, meaning that you have this teardrop shape and you didn't want it to rotate. So the textured portion was sort of acted like a Velcro, so it wouldn't rotate on itself.
Right.
But pretty much we're not seeing Allergan's version of those textured implants because they pulled theirs off the market. So in the United States, they pulled off Allergan textured or BioCell, that was sort of the name for it, BioCell textured implants off the market because there was a few places in Europe, like France and Canada, pulled off Allergan's textured implants too.
They were recalled, right? Like
They're recalled in Europe, in France.
Okay.
Here, the Allergan, the company, decided, you know what? Before the FDA says, hey, take them off the market, they voluntarily remove them off the market.
Right.
So, and for that reason, I have not used textured implants in a long time, and I only use smooth gel implants because there's never been any lymphomas associated with a smooth gel implant. So that's good, right?
Yes.
Because
I don't need to worry then.
Yes, that's a great question because
Right.
you have a breast augmentation. We use smooth silicone implants, and there's never been any case of a lymphoma with a smooth celled or smooth shell implant that we use. Let's say like in you.
Oh, good.
So yeah, I don't want you to worry, but we get a lot of people who do worry about that. And then we also get people who maybe come from other places, other surgeons who say, hey, I have a textured implant. They don't know what kind of implant. They just know it's textured. So what do you do then, right? Well, actually the FDA, these are the people who kind of make recommendations. The recommendation is, or the current recommendation by the FDA is that women with Allergan BioCell implants do not have to have their implants removed if they do not have symptoms of lymphoma. So the question is, what are the symptoms? Yeah. So the symptoms and most common symptoms are going to be an unexplained breast enlargement, asymmetry, fluid buildup, and it's actually that fluid buildup or seroma that causes that enlargement of the breast. It's usually not painful. So it's not something you wake up and go, ouch, my breast hurt. It's actually just a fluid buildup, and it looks different. So that's what someone first notices, that their breasts look different because there's a seroma on the other side. Sometimes you can get a lump in the breast or the armpit. If you have symptoms like that and you know that you have a textured implant, you definitely have to go see your plastic surgeon for them to take an evaluation to make sure it's not something else. But essentially, if there is something going on, you're going to need some, sort of imaging study, usually like a CAT scan, ultrasound, first to document the fluid. And then they're going to take some of that fluid, usually through a needle aspiration, and send it out for all these different things that may rule in or rule out the lymphoma that we're worried about. So
now, do people usually get it early when they get their implants, or does this develop over time?
They think it develops over time because it takes years and years for this inflammatory reaction just to occur over and over, and then finally your immune system somehow just gives up, or it starts dividing rapidly and uncontrollably. So we never see that, or at least the ones that have been documented have been at least 4 years out, usually like 10 years or so. Something you would not see in the first year or two.
Okay.
Yeah. I think most people would go see their plastic surgeon or that person if you notice those things anyways. So, but yes, anytime you see this abnormal swelling or asymmetry between the breast, you have to think, okay, do I have some sort of fluid buildup? And your plastic surgeon should think about those sorts of things. But it's textured implants, not smooth implants. So, Anjelica, you don't have to worry. You'll be just fine. But there are people out there with textured implants.
Yes.
And there are people who have Mentor textured implants, which are a different company. We have not seen anything like that.
Not a single one or anything?
No. It looks like they've all been linked to the Allergan because their texturing, the way they texture their implants was very aggressive, meaning theirs was more gritty.
Does that just help it stick on to like...
The idea was for it to really sort of stay in place, so it wouldn't bottom out, slide. The other thing was that it was felt that the gritty surface would decrease the body's ability to form a capsule, a real thick capsule, so decrease your capsular contracture. Yeah.
And did they see that at all? An overall improvement?
Studies have definitely proven that all textured implants do decrease capsular contracture.
Oh.
I would say as far as the bottoming out or movement of the implant, it wasn't as great as people thought. They still move around.
Yeah.
The gritty surface isn't like the Velcro that they thought it would be. Perhaps a little bit better than smooth, but it wasn't significant. So really, when people use textured, or at least the way I thought about it, it was more to decrease the capsular contracture rate, especially if you were putting the implant underneath the muscle, or on top of the muscle, subglandular. So, that whole debate, do you put it above or below the muscle? So for the most part in the United States, most plastic surgeons place it underneath the muscle because it gives a more natural, most natural contour in the upper part of the breast, and also decreases or keeps the rates of capsular contractures the lowest. Okay. So, however, if you're going above the muscle, there's a higher chance of capsular contracture if you're using smooth, but to bring it down again so you have low capsular contracture rates, a textured implant in that plane can help.
Oh, that's good.
Yeah. So
and
it's
usually, like what people who usually go on top of the muscle is more so who are candidates for that when they instead of going under.
Yeah, so, I think you could ask 10 plastic surgeons and find probably 5 different answers. But the way I think about going on top of the muscle is maybe someone who's a little bit heavier, who has really thick tissue. So there's a lot of tissue above the muscle, and you don't want to put an implant underneath the muscle and give them the appearance that they're top heavy or they're overweight, because sometimes you can get that. And they want that more defined look. So you put it on top of the muscle to give a more defined look so you can see the implant just a little bit more. Because if you're thin like yourself and you put it under the muscle, you're still going to have that defined look because you're very thin and you're fit. But someone who's a little bit heavier, and they want that look, they're seeing all the Instagram models and seeing that, super high cleavage look.
Yeah.
Sometimes you have to put it above the muscle. And that's the way I think about going above the muscle. Bodybuilders, that sort of thing. Some people make, an argument that for a real big bodybuilder, you should put it above the muscle so their muscle doesn't, push it down. But I've seen some of that happen and it does not look good because they have such a low body fat. They tend to look like a rock in a sock or a bowling ball stuck.
You can see the whole outline of the implant. A lot
and
of
it does not look good. So for the most part, I would say low body fat people probably better underneath the muscle.
Now, also, common question that I feel like I get through social media, at least, is saline or silicone.
Saline or silicone. So that's a great one. That's a debate that's been going on for years and years. Yes. And I'll tell you that American surgeons are probably the best in the world when it came to saline implants, because in 1996, remember, there was a worry that implants, especially if they ruptured, they were going to cause these autoimmune diseases. So there was this real big scare in 1996. And so the FDA mandated this moratorium. Basically, they told all the manufacturers, stop, selling these silicone implants, and told plastic surgeons you cannot use silicone implants till we figure out more what's going on. So for 10 years, the only thing available to plastic surgeons were saline implants.
Oh, wow.
And the rest of the world had access to silicone implants, saline implants. So American surgeons for 10 years just used silicone or saline implants. Got very good at them, and they probably have the most experience. However, in around 2006, they came back on the market after 10 years of extensive study to show that the silicone on the inside of all these implants did not cause these autoimmune diseases. And so 10 years of studies showed that there was no association. They put them back on the market, and then all of a sudden you had all these American surgeons using silicone implants because they tend to feel a little bit more real.
Yes.
And there's less rippling. So that's what it comes down to. I guess that's a long story, a long answer.
I mean, it's good.
Why do I choose silicone as opposed to saline the majority of time is because I think it feels more natural. And I think even more importantly, there's a less rippling. Saline implants tend to ripple on the edges. So someone who's really thin, you're going to see that rippling around the skin, around the implant. So, a lot of good debates. These are sorts of things that I always talk about with patients, why I choose silicone over saline. What happens if it ruptures? No, you're not going to have, these medical problems, autoimmune problems. How do you detect a rupture? That's another question.
Yes.
So with a saline implant, you're going to know because it looks like a flat tire, right? It's just like boom. And then after a day, the body reabsorbs it.
So it's just, you pretty much are like deflated.
Deflated.
On one side.
Exactly. Yeah. And your body will just reabsorb the saline water, as opposed to a silicone implant. Just like I tell all our patients, if you were to cut it, it's like cutting a gummy bear, and it's not going to leak out everywhere. But if we recognize it, we do recommend exchanging it. How do we recognize it? Sometimes you get a shape change. Sometimes something looks a little bit different compared to the other side. But the best thing to do is usually get a CAT scan, or more specifically an MRI. An MRI will tell you.
And what can cause those ruptures typically?
These newer generation implants are really so good. There's such a low rupture rate. We're really only seeing it 5% over 10 years. But what could cause it? Well, I show people with an implant, I kind of hold the implant up, and there's a little bit of wrinkling, even on silicone implants. Yeah. So in your body, whether you're laying down, sitting up, it's moving around just a little bit. And there's these folds that occur. And typically, it's on the upper part. And those folds that occur over years and years tend to wear down that one particular area. Yes. And then it may cause a little bit of a crack. Okay. But, I have not seen a rupture in many years in implants that I placed. And so that's over the past 10 years. And I think that just shows you the newer generation implants, I think are really good. And, people who are athletes, who are gymnasts, who, let's say someone gets in a car wreck and has a seatbelt, never has there been an association of like, hey, my implant ruptured because I fell or I got punched there or, whatever it might be. I was doing MMA wrestling and something happened. No, never been an association. But, it can happen. It's usually wear and tear. So,
well, that's
good stuff
though.
to know.
Yeah, of course.
But that's why I wanted to do this, because I think it's really important. Just a little bit of a nugget, a little bit of an idea, what it's like when you have a consultation with us here, when we talk about implants. You hit it right on the nail, right? Yeah. How do I choose between saline or silicone?
Right.
I have textured implants, or I heard about textured implants or implants in general. Can they cause cancer? And I think if anybody walks away from hearing this, I think the main thing is smooth silicone implants or smooth saline implants do not cause this lymphoma, nor do they cause any type of breast cancer. It's just those textured implants, Allergan in particular, that have been shown some of these, a few dozen or even a couple hundred in the world of these cases of lymphoma. But if you're having it, do you remember the symptoms to watch out for?
Let's see.
I'm giving you, just read it for everybody.
Unexplained breast enlargement, asymmetry, fluid buildup, or a lump in the breast or armpit. It's rare, but an overlying skin rashes or even hardening of the breast.
Sure.
So,
and that's why you need to see a plastic surgeon, because sometimes a hardening of the breast could be a capsular contracture.
Yes.
He'll know whether to, do some additional imaging studies. And then to diagnose it, it's going to be usually a needle aspiration of the fluid. You got to send it to the pathologist. So,
at least there's a way that they can test it and find it.
Usually if you catch it early on, it's very treatable. It is a cancer, and there have been some reported deaths, but it's been very few even for that. So the majority of people who have been diagnosed with this have been treated completely just by removal of the implant and removal of the capsule. Yeah. So, but anyways, that's why I wanted to do this little Dr. Dallas nugget size
educational segment.
Yes, exactly. A little quick one. So if you ever had any questions about, why should I choose one implant over the other? And more specifically, can implants cause cancer? Listen to it. You'll kind of find all the stuff here. If there's any questions, you can always hit us up on Instagram.
Yep. Snapchat, Facebook, whichever you prefer. Twitter, we have that too.
Yeah.
And then just ask us your questions.
Yeah, we'll answer it even, real time, something like that. So thank you guys. We'll try to drop some other nuggets. Oh, that sounds terrible. We'll drop another nugget on you. But so here's just a little surgery nugget for you guys. We'll have to come up with another good one that we hear people. But stay tuned. We'll catch you guys on the flippity flip.
See you later.
See ya.